Hello and welcome to a Heartland exclusive interview. I'm Christina Herrin, Government Relations Manager of Health Policy at the Heartland Institute, and today's guest is AnneMarie Schieber to talk about COVID-19 lockdowns and other regulations being implemented. Hi AnneMarie, how are you doing today?
Hi Christina, it's great to see you. I feel like just getting back together chatting. We see each other once a week in our managing editors meetings, so nice to be here.
I'm really glad to have you on. And I kind of just want to talk about your opinion on COVID-19 lockdowns and this second round of lockdowns that we're seeing across the country. I know states like California and Illinois are trying to implement restrictions on family gatherings like Thanksgiving and maybe even going further. What are your thoughts on that so far?
Well, I live in the state of Michigan, and today I was woken up by beep, 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 an emergency signal from my state government telling me my state is locking down for 3 more weeks. First of all, I have questions of how they're using public resources to alert people using their private cell phones on these orders. I mean, they were pretty well known, but they began today. They did this the first time, and there were some questions about it. Lockdown mania. Why isn't anybody asking why lockdowns didn't work the first time or the second time? We're doing it for a third time. There is no evidence that they do anything about putting a virus back in the bottle. Once it is out, it is out. And in fact, we know now, after 8 months into this, that they actually cause a lot of harm. Kids are not going into seeing the hospital or not getting medical care. People are not getting medical care. Suicides are up. Mental illness, substance abuse is up. So I don't know what the goal is here.
Yeah, I think that's really interesting to address the mental illness aspect. I think that has been neglected to be talked about, and these unforeseen consequences that politicians talk about a lot for many of us are very they're unintended supposedly, but we can obviously see that there are ramifications to these types of policies. So we'll probably talk about that more. But also one thing that's on everyone's mind is, when is COVID-19 going to end? And recently we've seen 2 potential vaccines that are in the process of development. What are your thoughts on these potential treatments?
Well, it's interesting. First of all, there's a lot of politics going on with these vaccines. First of all, I think it's an amazing thing that we've been able to develop a vaccine in the shorter period of time that we did, just a matter of months. It's very risky business for pharmaceutical companies to develop vaccines because there's so much risk involved. We don't know, first of all, what the virus is going to be like once these things are introduced to the market. We don't know what the safety and effectiveness is in a short period of time, although we can figure that out. And we don't know what the market is. I mean, flu vaccine, not everybody gets the flu vaccine because it is not very efficacious, like 50% of the time, because you're dealing with a replicating virus. So, just a small amount of the market does get flu vaccine. These have an amazing effectiveness rate. The one that came out this week by Moderna is, I think, 95% effective. The other one last week by Pfizer was 90% effective. What's interesting is, these were done under Operation Warp Speed, which the Trump administration began in July to encourage pharmaceutical companies to really devote all their resources into developing these much needed vaccines. And without that push, I don't know that we would be in the situation that we are today, where we might be able to be giving out vaccines in just about a month here. It was interesting to see how the announcements unfolded, because in October, if you read their releases, or at least Pfizer's, very closely, you will see that there was evidence that this vaccine worked early in October, yet the announcement was not made until a week after the election. I don't know why that was the case, but here's the key in the news release. It said that their next goal is to ask for emergency use authorization in the 3rd week in November. And the protocol for that is usually having 28-day span after the 2nd dose. So this was, the participants got 2 doses of vaccine, and they knew right away that this thing was working and could have announced it. What was interesting was Anthony Fauci did numerous interviews at the end of October saying we were not going to have a vaccine for months. And, you know, if there were anybody who would know, it would be him. And no one's really quite explained how that happened. But anyway, we are where we are.
Right. And how do you, in your opinion, do you think government can continue to, you know, step back and create an environment where a vaccine would be brought to market sooner? Are there any possibilities of that happening?
Well, you know, it'll be interesting because the next administration will have much say over how this vaccine is distributed. And then, you know, of course, there might even be some manufacturing hurdles and distribution hurdles, given the nature of a vaccine. It has to be refrigerated. It has to be distributed to the vulnerable populations first, healthcare workers and so forth. And they can only just make so much vaccine at any one time. I don't know too much about the Moderna vaccine, but the Pfizer vaccine, it's 2 doses. And so you have to double up on everyone who gets it. I think they had a capacity. They're going to have, I don't want to misspeak, but they have a capacity. They're all set to go to distribute this to a large number of people. And so, you know, I think there's going to be a large interest in using it. I think there's also talk about vaccine mandates, which I don't think is very smart policy because, you know, people are all different. Top-down approaches, as we're learning from the lockdowns, do not work. Everybody is different and unique. The best person to make this decision is the patient, along with their doctor. So, you know, I just kind of want to throw that out there because I've heard talk about some states or even, you know, if you work in a hospital, for example, you have to get a flu vaccine for many people. But, you know, whether that's going to work at a public level, I don't know.
Sure. Do you have any more thoughts on rollbacks and regulations since the start of COVID-19 and how the government's stepping aside, whether it's certificate of need law or you know, limiting some of the regulations on hand sanitizers or even testing could help aid healthcare workers or just patients in the process?
You know, it's amazing. It took a pandemic to show how difficult our medical system is to be effective. We saw so many hurdles and how quickly we were able to remove these hurdles and how quickly the system responded. I should probably show you, our co-publisher, John Goodman, just came out with this book, taking a look at all the new ways that the pandemic exposed the dysfunction in our healthcare system. And so this thing, we've been writing about it in Healthcare News. John is a co-publisher of our publication, Healthcare News. I can't wait to but he's just been keeping track of all these things that could be changed with certificate of need. You know, for example, some places like in Florida, there was difficulty. We've talked about this, you and me, about certificate of need. The counties there control ambulance service. And so there was a time during a big peak in the virus for people to be able to get ambulance care, but they needed approval from a board in a particular county. You could not drive over the county line to go pick somebody up to bring them to the hospital. So it's just little things like that that were really standing in the way of people being able to respond to the virus. And, you know, really in a life-threatening way in some cases.
Right. Well, thank you for that insight. Do you have any other final thoughts for our audience or anything regarding upcoming, you know, COVID-related issues?
Well, I have 2 things I want to mention. The surge numbers, we're seeing a huge number of people testing positive. I drive around my town and I see lines of people online getting tested using PCR testing, which we know has a high rate of false positive results. And I'm really convinced that that's what is driving these numbers. You know, I have a family member who is sick, doesn't know what she has. We looked around for a rapid test. I cannot find a rapid test within an hour of my home. I don't understand why public governments, state governments are not more focused on getting those tests to people. They are not as sensitive as the PCR test and probably give more realistic results of how really how much the virus is spreading. The second thing is tomorrow I want to alert everybody to a hearing. I'll put it up on our website a Senate hearing by Senator Ron Johnson of Wisconsin. They are talking about early home COVID treatment. So a group of doctors, a growing group of doctors, have been advocating for changes in NIH and FDA guidance regarding antiviral medication to be used at the early stages of COVID at home to avoid hospitalization. It's a very difficult thing to try to test in a randomized controlled trial. This is a pandemic, we're in an emergency, but there is enough evidence to show that this really does keep people out of the hospital and stave off death.
Right. Well, we will definitely link that below as well if you're watching on YouTube. AnneMarie, thank you so much for the update here, and I really appreciate talking with you today.
Well, thank you for Christina. Thank you, Christina. There's a lot going on. I appreciate you giving me the time to chat.
Yeah.